Welcome back to the Thom Hartmann Program. Staying with us in studio, Dr. America. You can check out his show at weactradio.com. You can also find it on iTunes, and you can search for it on Facebook.
Right.
Dr. America, and Dr. Sanjeev Sriram is the mortal who morphs into Dr. America to fight for health justice for all of us. I recommend everyone check out his work and his writings, which you can also read his writings at the Huffington Post. Let's go to Norma in Alabama. Norma, you're on the line.
Hi, Alex. I had originally wanted to talk about Social Security, but since you have a doctor there, I want to ask him, how does he feel about having 2 outbreaks of live active TB in a state that did not take the Affordable Care Act to expand Medicaid? And we've had deaths last year from active TB. And this year we have another outbreak. Most people do not realize that we are not a static society. We move around. And if you think that someone doesn't deserve health care, but you're still going to allow that person to fix your food at the fast food joint or put your bowl of salad in front of you in a restaurant, how much of a risk does this put the population at? And aren't you thankful that it's just TB and not smallpox?
Yeah, I think that she's posing excellent questions and excellent scenarios that we have to consider as we look at what is broken in American healthcare. And she's absolutely right that when we are so hung up on this notion that my status depends on my having access to healthcare and you have to be beneath me, and being beneath me means you don't have access to healthcare. When we have more allegiance to that stratification of our society than we do to some basic principles of health justice, we can't be surprised when things like tuberculosis, which, that is a 19th century disease that we managed to kill in the 20th century. And here we are in the 21st century, and it's still a threat because we seem to care more about stratifying ourselves and each other than we do about just looking out for each other the way that we were talking about. One of the other things that the caller pointed out is that even if we were to get to a place where everybody has affordable, accessible healthcare, we would still need the kind of workplace policies where you could take time out for yourself to recover from an illness, come back to work, and still have a job. And she's absolutely right about, the service industry, really exploiting people at times when they're sick, and the public health consequences are proven.
Right.
There were when the H1N1 flu epidemic hit a few years ago, there were over 1 million cases of flu that hit the United States simply because people were showing up to work sick because they were stuck in that false choice of, I can stay home and get better and lose my job, or I can keep my job but continue to get sick and feel worse because I'm not taking time out for myself. Again, these are not choices that, that I think decent people should be, should be facing with each other. And if we cared more about each other than stratifying each other, I think we wouldn't have to deal with it.
And not only that, but there is no way that billionaire on Wall Street, guess what? Unless he lives in a hermetically sealed bubble, the health of everyone is going to impact the health of that individual as well. We are literally in it all together. Sanjeev was just saying, somewhat apologizing for going on a rant, and I was like, have you literally ever listened to me on the radio? Because if your alter ego, if is Dr. America, mine is like Ragey McRant's pants or something. When it is about justice, right. I get the feelings, and so I encourage more of that. Kate in California, you're on the air with Dr. America and me.
Hi, gentlemen. I'm recovering from chronic bronchitis, so bear with me. This relates to my question. 64 years ago, when I was born premature at 4 pounds, I was put in an incubator and released to parents who were chronic smokers and who smoked in the home and the car, which resulted in long-term asthma and bronchial issues my entire life. At what point do we not address that the society has a group of corporate, corrupt people who push poor food, smoking, all kinds of implications to our public health, and refuse to take responsibility, and it continues without the proper education. Now, the tobacco companies were slapped on the hand and all these funds were created, but it still doesn't address this drift towards corporations not taking any responsibility for the quality of the water and the air and what we've done to our environment, which affects us and our health. And this is something that is not addressed in the media at all, just like, climate change. So I'm wondering, what do we do as a society, and why do we blame people like myself? I'm 64 now. I'm blamed for something that happened to me. I had no responsibility. I was born into that environment. And I really appreciate the work that you all do there. Thank you.
Oh, thank you, Kate. Kate, what's interesting about the tobacco industry and how they the lessons that they learned and what they walked away from when they had to do like that multi-billion-dollar settlement is that I feel like a lot of corporate America looked at that and they didn't look at public health on one side having a triumph over this major cause of illness and death in America and say, you know what, we're going to take the side of public health on that one. We're going to, do right and be on the side of making people better and improving wellness across the board. They instead looked at big tobacco and thought to themselves, how do we not end up on that losing end of that settlement? And they kept looking at the wrong side of that situation when they had every opportunity and they had all the resources to come over to public health and ask and work with public health professionals to say, what can we do better? And instead they wanted to, this is why things like trying to get city councils to look at, okay, are we do we really need this much junk food and soda in vending machines in schools? The moment that comes up at a small city council meeting, you've got Big Soda right there lobbying against it.
Right.
And it's because they don't want to end up as the next big tobacco loser. And to me, what's devastating about this, everything that Kate was talking about, is that these are opportunities where we can talk about, public health, improved nutrition, creating the kinds of environments that make healthy choices easy choices. But that's not what our corporate friends are wanting to do whatsoever.
Dr. America is going to take more of your calls right after this.